Hello everyone, once again welcome to my OET channel. Today's video we will discuss regarding one reason exam oriented OET speaking role play. So if you follow my OET telegram group, you can see the separate PDF in which I have added all recent OET case notes and the same way the role play cards also. So you can refer for that. So today we will see among that one role play in which I will just explain you what are the content, the task and what are the subtask, how we have to ask in a OET oriented way. So when as you know that whenever we will do the role play, there should be some features we have to keep it in our mind. The first of all, it should be like a polite manner, and the second one should be it should not be like not demanding way, and grammatically there should not be any mistake, and the important thing, you have to keep the flow. There should be any pause. The normal pause, it's okay, fine. Even the native speakers, they will have the pause, the hummings, everything, so it's not a problem. But there should not be a long gap. So how we can maintain all these criteria, we can see. So we will move to the role play. So in this card, I will just explain you the setting. It is emergency department, and the nurse role is you see a patient in his or her late 60s has come to the emergency department because of a possible overdose of NSAID, non-steroidal anti-inflammatory drug. He or she has been very forgetful, has been vomiting, and has had abdominal pain. You are assessing the patient in triage. So, first of all, during the 3 minute preparation time, you have to be in the scenario. So, that is important thing. You have to think that you are the charge nurse in the emergency department and you are approaching a patient who is nearly 60 plus age, and he or she is on NSAID normally, and because of his forgetfulness, he took some extra doses, so he don't know how much he took, and he's complaining that he had already vomited and have abdominal pain. So you are in triage and you are assessing the patient in triage. So now you can imagine that you are sitting in the triage and you are with the patient, and he's telling that he has taken some tablets and he's having abdominal pain and he vomited, like that. So you can imagine, then we can start marking. Then what else you have to do the next? So first, you will read the scenario, then you will go to the task. So what you have to do, you should not completely underline. Only the important things you can underline. As you know that for the exam you will get some task like with more subtasks. Example, you can see the second, third, fourth and fifth tasks are with the subtask. Only the first one will be with a single task. So you can just underline, find out reason for patient visit. That is the first underline. So you will ask the patient regarding the visit. So from here we can come to know that this is a unknown scenario. You didn't see the patient yet. Now we are going to see the patient, because the first task is find out the reason for patient visit. Second one, find out more details. You can just underline type of medication, number of tablets. The next one you can underline symptoms. Then next one, you will go to the third task, advice need for test. That one you can underline. Then you will underline the liver function, stool culture, etc. Then next one, you will underline examination by doctor and monitoring. That's enough. So no need for underlining each and every points. Just what are things I'm telling, you can just write, because when you will do the conversation with the interlocutor, you will have the eye to eye contact with him or her. So you will be away from the the card. Then again, when you will come back to the card to ask the next question, you will get confusion from where you stop. So it will be easy for you to get rid of these confusions. Then the next task, you can just underline resist request for diagnosis. You can tell that you are not in role of explanation. Then the next one, you can just write underline purpose of the triage. That's enough. The last one is a reassurance. Then in the last task, you can just underline offer to discuss antiemetic medication. Then patient's consent for the test. That's enough. Now you will have some underlining, so it will be much easy for you for the free conversation. Then now I will explain how it will go. Example, the patient, the name is, this is unknown scenario, so no need to ask the patient's name in prior. So you will start with example, your name is, I will tell you. So my name is Rashmi Rajan. So I will tell like this. Good morning, my name is Rashmi Rajan, one of the registered nurses working in this emergency department. How may I address you and how can we help you today? That's enough. Then the patient is telling that, good morning, sister. My name is Jacob, and actually, I came here with the concern that I have, by mistakenly, I have taken like overdose of some of my medications. So I am so much worried about that. Then we can tell that, oh, I am so sorry to know about your problem, but no need to worry. You are in our safe hand. So just like a reassurance we have to give. Next task is find out more details about the type of medication, number of tablets. Then we can ask like this. For my better understanding, could you please tell me what type of medication you have taken and how many tablets you have taken? Then the patient is telling that, actually usually I'm taking now this NSAID for my osteoarthritis, and there is antihypertensive drug. I don't know what all the medication I took and how much tablets I took because I am having this forgetfulness. Then we can tell it's okay, fine, no problem, no need to worry. We can manage your condition without any complications. Then we can ask, okay, Mr. Jacob, could you please tell me what are the symptoms you have and what are things you have experienced at home soon after the conception, consuming the medications? Then he's telling that actually after the overdose of medications, actually I vomited once, and now I have abdominal pain. Then we can ask, do you have any other problems such as respiratory problem, or when you vomit, is there any blood stench in that, if or there is any bleeding from the gums or nostrils? Then he is telling that no sister, I don't have any such symptoms, only this is the things happened. Then we can tell that, okay, all right, Mr. Jacob, this is not a complicated cases, so you have vomited once and you have only abdominal pain, right? Then he will tell, yes sister. Then we can advise the need for test. Then we can tell that, okay, Mr. Jacob, I would like to tell you that there is a need for further test to identify the reason for your symptoms, such as liver functions test and stool culture. And after the test, you will be examined by the doctor and we will monitor for a specific time period. Are you following me? Like that we can ask. Then the patient is asking that, could you please tell me what is the diagnosis for me and what is happening to me? Then we can, next answer is resist the request for diagnosis. Then we can tell, whenever you will tell no, whenever there is a scenario for telling no, you have to tell like this. Oh, Mr. Jacob, I am so sorry to tell you that I am not the right person to inform you the diagnosis, but no need to worry. That no need to worry should be there, okay? But no need to worry. After the complete analysis, your doctor will explain you in detail regarding your diagnosis and further management. We can tell, for now I am in the triage, and for me my job is only to assess the seriousness of the cases and I will decide the appropriate action. So I will hand over you to the doctor. Is it okay for you? Like that we can ask. And there is already a reassurance is there. We can tell that soon after the, that's the same thing what I told you. Soon after the examination by the doctor, he will prioritize the case and he will give you the management without any delay. How does that sound? Like that we can ask. Then the last task is offer to discuss antiemetic medication to treat nausea with the doctor. So we are explaining regarding the medications. Now, actually, we can ask, do you have any other concern? Like that we can ask. Then the patient is telling that, actually, I want to know that why I am feeling so much sick. Actually, I don't want that. I want to get rid from this. Like that patient is telling. Then we can tell, I am reassuring you, Mr. Jacob, no need to worry. Now your problem is abdominal pain and you have vomited once, right? So I want to discuss regarding the antiemetic medications, and this is to treat your nausea and vomiting. Of course, after the assessment, your doctor will prescribe that medication, and after the medication, I am reassuring you that you will be all right very soon. Are you okay with that? Like that we can tell. Establish patient's consent for test. Then we can tell, do you have any other concern? Then patient is telling, no, I don't have any other concern. Then we can tell, I hope I have clarified all your doubts. If you don't have any other concern, may I proceed with the further test? And we have to ask the patient to take a seat. Then we can ask, please have a seat here. And when your turn will come, we will call your name and you can come to the assessment area, so that we will follow other tests and management. Is it okay for you? Then the patient will tell, it's okay sister, it's fine, I will wait here. So that's the ending of this scenario. So this is the role play, and this everything should be completed within 5 minutes. Throughout the role play there should be reassurance, because this is the emergency department and patient will be very panicked. And from the start till the end we have to reassure the patient, and in between we have to ask, do you have any other concern? Are you following me? Is it clear for you? How does that sound? These all connectives should be there, and there should not be repetitive. And when you are using how does that sound, it should be in the correct proper place. Whenever you will give a suggestion, there only you have to ask, how does that sound? Or else you can use, are you following me? Is it okay for you? Then is it clear for you? So like that you can ask. At the end, the emergency department, you are a triage nurse, so the conclusion will be, please wait here for a while, we will call you by name, then you can come for further test. Is it okay for you? Like that only the conclusion will be there. But if you are a respiratory, if you are emergency nurse inside the RR or emergency department, there will be the further procedure, or it will be further consultation with the doctor. Means you have to tell that, if you don't have any other clarifications, may I proceed with the clinical observation or vital sign checking, or let me get your doctor. Like that the scenario will change. So that's the thing I told you, that you have to imagine where you are. You are not inside the emergency department, you are in triage. So the triage nurse, it's different from emergency departmental nurse, but the name is emergency nurse. So you have to be familiar with the scenario, be with the scenario, be with your role, then it will be easy for you to handle the scenario. Okay, so I hope it's clear for you. Just practice in the same way. If you follow my Telegram group, same as I told you in the beginning, you can see the file section there, you can see the PDF section, and I have written its reason, examination, case note, and recent role play cards. So in that you can get many exam oriented questions, and you can refer, you can prepare yourself with the letters and role play. And role play, of course, you can discuss with your friends, so it will be easy for you and it will be beneficial for you. So I hope it is beneficial for you, this role play discussion. We will meet you with another one role play. Until then, bye, take care.